Think back to the year 1997. You're getting older, you're living alone, and it's getting increasingly difficult to take care of yourself. The simple day-to-day tasks that you had taken for granted in your youth has diminished, and now you're barely managing, if managing at all, to do something as simple as feed yourself, thereby delivering essential nutrients to your aging body. That's when your neighbor informs you about this wonderful program, Meals on Wheels, which promises to deliver a hot meal full of all the nutrients you need delivered right to your front door. This is just what you were looking for, so you sign up just so you can eat a nice hot meal and are put on a waiting list. Now, I know we're playing make-believe, but 15 years ago, this was very much a reality. Right here in Alameda County, hundreds of seniors were waitlisted and therefore couldn't take proper care of themselves by doing something that truly is a necessity of life, eating food. This was the case until then Director of Nutrition for ValleyCare Health System, Gabrielle Chow, had a radical vision that involved utilizing a spacious yet neglected kitchen on the Livermore campus and transforming it into the successful community nutrition program kitchen that it is today. When ValleyCare first became involved with the Meals on Wheels program, 450 seniors in the east and south sections of Alameda County were delivered hot meals. It was then that ValleyCare pledged to put an end to the wait list and promised that no senior would go hungry again. Today, more than 900 homebound seniors residing in 7 different cities, including Pleasanton, Livermore, and Sunol, are given a nutritious meal to eat 5 days a week.
We really wanted to outreach to our community and improve the nutrition of our elder population in this area. We provide hot meals Monday through Friday, but we also provide meals for Saturday and Sunday, and that goes out as a frozen meal for them. We also, due to our large ethnic population of Meals on Wheels, we offer a couple different programs. We offer our rice program, where in addition to their regular meal, they can get rice every day. So even if they're having something that isn't maybe an Asian type meal, they still get their rice. We also offer tortillas every day. So even though it might not be necessarily Hispanic type of meal, they still have their tortilla, which they're used to. It's a comfort food to them. In addition to our meals, we also provide a vegetarian menu. So if a client, due to religious or cultural beliefs, will not eat meat products or poultry, we offer a vegetarian alternative.
Every morning, Gabrielle's staff of dedicated and loyal food service workers show up at 5 a.m. to begin the arduous task of cooking for hundreds of seniors. And it's not just slapping together a few peanut butter sandwiches and sending it off with a bag of chips and a piece of fruit. No, these meals are hot, filling, and most importantly, supply our seniors with the essential nutrients that are critical for their health and well-being as they age.
There are certain nutrition requirements that need to be met. They need to be a certain amount of calories. They need to be high in certain nutrients that are really important for the elderly population, ones that they quite often are deficient in, such as vitamin A, vitamin C, fiber, calcium. So we make sure that they are adequate in those nutrients.
I think it's a good thing for seniors, that for one thing that they don't cook is one thing, and the other one, they always say that they don't get the right kind of food and everything. In this way, you get the variety of food because you get vegetables every day, you get a meat product every day, you get your beverage every day.
Besides the nutritional value of the food, Meals on Wheels is also critical for seniors who have trouble taking care of themselves by alleviating the difficulty of daily chores such as shopping for food, cooking it, and cleaning up afterwards. Additionally, past data has shown that patients who are discharged from the hospital and who are also Meals on Wheels recipients have a significantly smaller chance of being readmitted into the hospital.
I don't do that anymore. For one thing, it isn't that I can't cook. It's just that the strain on my back and everything is very painful. So I try to avoid that. And everything, and 9 out of 10 times I'm in my recliner with the heating pad on my back all day long, because that's the only thing that helps me.
A lot of our patients leave and then they're eligible for the Meals on Wheels program, so we make sure that they continue with receiving nutritious meals. Also that the adult population is getting older, and the need for a program like this where they are given a substantial, nutritious meal, especially getting those nutrients, those key nutrients that they're quite often deficient in, is really important. Keeping their nutrition status as close to ideal as possible helps fight off diseases, helps fight readmit into the hospital, helps them with their daily living.
But it's not just about nutrition or simplifying their daily tasks. For many seniors, it's about the interaction with their deliverers, which oftentimes leads to a special connection that means more than words can describe to these lonely recipients.
Some of these clients, this is their only time they get to meet with somebody else. So they really enjoy having somebody come in, check on them daily. They get that social interaction, but they're also, this is their lifeline, some of them. This is the only person who's coming in to make sure that they're okay. The Meals on Wheels volunteers and staff is basically the person that checks on them every day. And if they're not feeling well, or if they need to be taken to the hospital, they know who to call for that, and it's really, really important for these people.
I enjoy seeing these people and just the smiles on their faces, and they're very grateful to have a meal delivered to them so they don't have to prepare. And some of these people are physically handicapped, and they have caregivers that come in and go, but they're not able to cook for themselves. And they enjoy having the meal delivered, and it's kind of nice seeing the smile on their face, when we deliver to them.
All the people that I've had dealings with have been very comfortable. Makes me feel good.
But the outpouring of food doesn't stop there. ValleyCare is also instrumental in helping to feed and educate children of low-income families as part of the Head Start program. This program not only teaches children about nutrition, but also teaches them table manners and proper hygiene, such as washing your hands and brushing your teeth as well.
We have a family-style menus where the children all sit together with the teachers, and we serve with all the food items, the food groups, on our plate, before we expect the children to. And the children, we also train the children to self-serve. So all the food is available to them and all the groups, and we talk about the food groups in the beginning of the year and throughout the year. Actually, we do a lot of cooking activities, and we bring, we connect those cooking activities, providing them hands-on experiences, and bring that experience to the table. So they're not surprised to see the colors or different textures and the tastes and the shapes. And so we do it in a more interactive and more educational way, so that it helps children to, actually familiarize with the different food groups.
Head Start also helps educate parents as well as their children on the nutritional value of different foods.
We encourage the parents to take them grocery shopping and identify the different food groups over there and try to talk about stuff and involve the children at home, and sometimes parents do come back and give us a feedback on how that has been a wonderful experience to them.
ValleyCare became a part of this program back in 1998 by feeding 170 little mouths, and today ValleyCare now cooks for 238 children that delivers to 7 different sites. So you see, ValleyCare doesn't just provide health care for those patients who come in because it's an emergency or because of an annual checkup. No. Our health services reaches far beyond our sliding glass doors and out to the entire community, because we are ladies and gentlemen, caring for ladies and gentlemen.